What if your doctor has been misdiagnosing your headaches this entire time? There is one well-known, commonly overlooked cause of chronic headaches and migraines that gets missed in standard medical visits every single day. And if nobody has ever checked your jaw, there is a very real chance you have never gotten a real answer. The headaches you have been suffering from for years may have nothing to do with stress, nothing to do with your sinuses, and nothing to do with how much water you are drinking. The real cause might have been hiding right in front of your ears this entire time. I am talking about a tiny joint in your jaw that most people never think about, and when it breaks down, it does not just cause jaw pain. It hijacks your entire head. We are talking debilitating migraines, ear pressure, neck pain so stiff you can barely turn your head, and a clicking or popping sound that you have probably been told to just ignore. Here is the truth. You should not ignore it. That click is a warning sign, and the longer it goes untreated, the worse the headaches get. My name is Dr. Megan Tomberlin, and I am a chiropractor at Waves of Wellness Chiropractic in Leland, North Carolina. I have helped patients who have been to their primary doctor, ENT specialists, and dentists, all looking for answers, all walking away with nothing. And in many of those cases, the root cause was the same thing: TMJ dysfunction. Today I am going to show you exactly why this happens, how it is connected to your migraines, and what you can actually do to fix it for good. So let us start with the big question. Why does your jaw click or pop in the first place? That sound you hear is coming from your temporomandibular joint, which most people call the TMJ. This is the hinge joint that connects your jawbone to your skull. You have one on each side of your face, right in front of your ears. When this joint is working properly, it moves smoothly and quietly. But when the muscles, tendons, and small disc inside that joint become tight or misaligned, you get that clicking, popping, or grinding sensation. And for millions of people, that is just the beginning of the problem. Here is the first shocking reason your jaw is clicking: chronic stress and clenching. Most people do not realize they clench their jaw. It happens when you are stressed at work, when you are driving in traffic, when you are staring at a screen, and most commonly, while you sleep. This constant low-level tension in your jaw muscles builds up over time like a rubber band being stretched too tight. The masseter muscle, which is one of the strongest muscles in your entire body relative to its size, can hold an enormous amount of tension. When it stays locked up day after day, it pulls on your jaw joint, compresses the disc inside, and creates the clicking and pain you feel. That same tension radiates upward into your temples and the base of your skull, triggering the exact type of headaches that people often mistake for migraines or sinus pressure. The second reason surprises a lot of people: your posture. Think about how much time you spend looking down at your phone or hunched over a laptop. When your head drifts forward even just a couple of inches, the weight and strain on your neck muscles increases dramatically. The muscles at the base of your skull become overworked and tight, and those muscles are directly connected to the ones that control your jaw. So when your neck is out of alignment, your jaw pays the price. This is why so many TMJ sufferers also deal with stiff necks, upper back tension, and headaches that seem to wrap around from the base of the skull all the way to behind the eyes. It is all connected. The third reason is one that gets missed the most, and I see this in our office regularly. TMJ dysfunction is frequently misdiagnosed as something else entirely. Patients come in thinking they have a sinus infection, an ear infection, or even tooth pain. The symptoms of TMJ can feel like pressure behind the cheekbones, fullness or ringing in the ears, and pain that radiates into the neck and shoulders. Because these symptoms overlap with so many other conditions, people end up on antibiotics, decongestants, or pain relievers that do nothing for the actual root cause. Months go by. The problem gets worse, and they still do not have answers. If that sounds familiar, please know that you are not imagining things. Your pain is real, and there is a very real structural reason behind it. So what do you actually do about it? At Waves of Wellness, we take a comprehensive approach to TMJ and headache relief. The first thing we focus on is restoring proper movement in your neck and upper spine. When the joints in your cervical spine are restricted, they create tension that feeds directly into your jaw muscles and triggers headache patterns. Chiropractic adjustments help free up those joints so your body can move the way it was designed to. For our patients dealing with tight jaw muscles and that deep, stubborn tension that just will not let go, my colleague Dr. Jordan uses a technique called active release therapy, or ART. This is a specialized hands-on method that breaks up scar tissue and adhesions in the muscles and soft tissue around the jaw and neck. It is incredibly effective for people who have been dealing with chronic TMJ tightness for a long time. And for the patients who need that next level of muscle relief, I personally use dry needling as part of the treatment plan. Dry needling involves placing very thin needles directly into the trigger points inside the tight muscles of the jaw and neck. Now, I know that might sound intimidating, but most patients are genuinely surprised by how comfortable it is and how quickly they feel results. What dry needling does is essentially reset the muscle. It interrupts that cycle of constant tension, promotes blood flow to the area, and allows the muscle to finally relax. For people dealing with jaw pain, TMJ clicking, and headaches that have been going on for months or even years, dry needling can be a real turning point in their recovery. Here is what I want you to take away from this. You do not have to keep waking up with headaches. You do not have to keep popping pain relievers just to get through the day. The clicking in your jaw is your body telling you something is off, and the good news is that it is treatable. We see patients from all across the Leland area, including Wilmington, Brunswick Forest, and the surrounding communities. Whether your symptoms just started or you have been dealing with this for years, we would love to have a conversation with you and see if we can help. If you are ready to stop guessing and start getting real answers, give us a call at 910-859-8359 to schedule your first appointment today.